Do you look at your toes and think that they are looking crooked? Or do you have an older relative that has really crooked toes and you worry that yours might look like theirs? Well, if your small toes look bent in the middle, then you have hammertoes. A hammertoe deformity is probably one of the most common foot deformities we see in our office. Hammertoes can be flexible or rigid. Usually the flexible ones tend not to be painful, but they can develop some redness on the top of the toes due to friction from shoe gear. It is the rigid hammertoes that tend to stay crooked all the time and can develop painful corns on the top, on the sides, or at the tip of the toes, which can hurt in closed shoe gear. Although there could be a genetic tendency to develop hammertoes based on which foot type you inherit, there are some external causes that can make the deformity worse over a period of time. One main cause of rigid hammertoe development is high-heeled, narrow shoes. These types of shoes place abnormal pressure on the toes and keep them bent in the contracted position, leading to muscle imbalance and muscle tightening around the toes, resulting in permanent contracture of the toes. Other causes of hammertoe deformity include direct trauma to the toe leading to bone or tendon damage, certain neurological diseases such as stroke, and a big bunion that pushes lesser toes to the side and often lead to bending the smaller toes. So what can be done for hammertoes? The non-surgical management of hammertoes include wide shoe gear, avoiding high heels, using various over-the-counter cushions, and non-medicated corn pads to relieve symptoms when wearing shoes. A few words of caution to my patients with diabetes that have painful corns on their toes. If you have diabetes with poor circulation in the legs or poor sensation in the feet, be sure to come to our office for our advice before attempting self-treatment. One misstep in self-treatment in such a case could lead to complications such as ulcers, infections, and gangrene of the toes. Therefore, it is very important that you come to our office for an evaluation if you suffer from any hard skin lesions on your feet and you have diabetes with compromised circulation and or sensation. As far as the permanent treatment of hammertoe is concerned, there is only one way to do it, and that is surgically. The surgical treatment of hammertoe is usually indicated if the conservative measures fail and if the patient is medically stable to undergo elective foot surgery. I usually perform hammertoe surgery as an outpatient procedure at a nearby hospital under local anesthesia with intravenous sedation. The surgery usually consists of partially removing the prominent bone in the hammertoe and realigning or cutting the soft tissue around it to make the toe straighter. Sometimes the joint is fused, especially if the joint contracture is severe. A metal wire may be used to stabilize the toe as it heals in a straight position, which is then easily and painlessly removed in our office. The hammertoe procedure takes about 30 minutes to do. It has a high success rate, and most patients are back into regular shoes within a month. I would like to offer one final note to patients who have no pain or limitations from the hammertoe but are considering cosmetic surgery to make the toes look prettier. I would like to advise you not to have surgery if there is no pain or functional limitation from your hammertoe deformity. Although this is a low-risk procedure, it is not worth taking the inherent risk of surgery just to make your toes look prettier. So if you have hammertoes or you have a genetic tendency to form crooked toes, then just come to our office for an evaluation. We can check the biomechanics of your legs and feet, look for the underlying causes, and discuss how to address them.